Hi everyone, in today's video we will see what are the common skin problems that you can see in a neonate and infant and children, and what is the skincare routine that you need to follow for them. So we'll divide this video into skincare problems in infants, that is from birth to 1 year of age, and toddlers from 1 year to 3 years, and children 3 years and above, but we'll group the toddlers and children into one group. Now coming to the skin problems in infants, commonly at birth there can be some reddish patches with the central pustule or pus-filled or reddish bumps in the center of the patches. Now this is normal and it will go away after a few weeks. There's nothing to worry. We can also come across birthmarks, that is vascular birthmarks, which can come on the face, reddish patches that can come on the face. It will disappear by 5 years of age, but in some children, in some babies, the hemangioma, or what we call the birthmark, can increase in size, and that time you will have to seek a pediatrician's help or a dermatologist. And the other birthmarks, any doubt you have, any concern, you must show your pediatrician. The other things that can commonly be seen in infants are cradle cap, which is basically greasy scales on the scalp that will go away after some time. There is no cause for concern, but these children may develop atopic dermatitis at a later date. And you can have something called as Intertrigo. Now Intertrigo is basically reddish patches on the folds of the skin as well as on the creases, and mostly seen in overweight babies. This is because of moisture retaining and also an infection. So it's important you look for those patches as well. Then what you can commonly come across is diaper dermatitis. Now diaper dermatitis happens because of long exposure of the baby's skin to urine and infrequent changing of diapers. So it's important to change the diapers frequently. Now coming to children and toddlers, they can come because that's the time they start playing in the sand. They can develop certain infections called impetigo, which is a bacterial infection. It can be treated very easily. It comes as brownish crusted patches and sometimes with oozing. They can also have viral infections called as Moluscum contagiosum, which is basically whitish bumps on the face, commonly seen on the face. This is also very easily treatable. They can also develop sweat rash, that is called malaria rubra, because small tiny reddish bumps on the folds can be itchy. That's because of sweating. Then commonly what children see is atopic dermatitis. Now atopic eczema is basically a genetic alteration which makes the skin more susceptible to environmental factors like dust and food allergies. Now this atopic eczema can occur at any age, but usually starts before 7 years of age, and they can have very itchy reddish patches on the cheeks, sometimes on the neck, on the elbow bends and behind the knees. So these can trouble the sleep. It can make it very difficult for the babies as well as the parents. So the skincare routine that you should follow is, one is cleansing. Now you must use a mild pH Syndet bar for the babies. Usually the newborn skin is more alkaline, which is about 5.5 to 6 the pH, and as the child grows up, the pH of the skin tends to become slightly acidic. So you must use a Syndet bar, and make sure even when you use a shampoo, it should be a mild shampoo which contains amphoteric surfactants. So you must look for these. And moisturizing the skin is extremely important. Use only extra virgin coconut oil or oat oil is okay for the newborns and children. Do not use olive oil, do not use mustard oil for baby skin. And there are good moisturizers available. Please do check with your dermatologist for a good moisturizer. And you need to use a good diaper cream before changing the diaper, or before every time you change the diaper, a diaper cream must be used. That is nothing but a zinc cream. And make sure all the folds, the creases are aired out, especially after a bath. Make sure that you dab dry with a fine cloth or a clean towel all the creases. Now if the child is atopic, moisturizing is very, very important. Keeping the baths short. Lukewarm water is important. Don't use any basin powder or any powders to wash the baby, because that can cause more dryness and more irritation. Do not use baby powders for the child. Do not use any wet wipes which contain alcohol or strong scents. And avoid allergens like dust and carpets, pets, and furry toys for an atopic child. And also make sure that you avoid egg white, nuts, soya, and berries. I hope you found this video useful. Thank you very much.